So I have mentioned myself, Dee Sheridan. I also have my colleague, Dr. Brian Hallahan. He's the head of international students in the School of Medicine. He's a senior lecturer in year 4 of the medical program, and he's also a consultant psychiatrist at the University Hospital Galway. We have Professor Becky Way, who's the Vice President for International at NUIG Galway. We have Professor Peter Dockery, who's our Vice Head of School of Medicine, our Year 1 Head, and also an established Professor of Anatomy. And we're delighted to have our colleagues from NUI Galway Admissions, Miss Mary Liddy and Miss Catherine Geraghty, who have all been working really hard behind the scenes to get your offer letters out and manage that entire process for us. And finally, but not least, we have Selena from Atlantic Bridge. And Selena has kindly organised all of the technology for the event today. So thank you, Selena, for all your hard work on that. It's never easy to manage the technology piece of any event, so we appreciate it's all going smoothly so far, and hopefully it will stay that way. So I'm just going to hand you over to Dr. Brian Hallahan, and Brian is going to talk to the COVID-19 situation here in Ireland, and also in a NUI Galway context, and more specifically at a School of Medicine level. So Brian, I'll hand over to you at this point.
Thanks very much, and it's lovely to see all the names as well. I recognise many names from, again, interviews and other webinars, and I decided not to use any slides, just to chat about COVID and the Irish situation. Ireland has been quite cautious, I think, in managing COVID, and I think that's been a very good policy. So at the moment in the country, there are 40 patients in hospital that have a COVID-related illness, of which 13 are in ICU, many there for a long time. That's a huge improvement over time. For example, in Galway, there's not one patient in the hospital, there's 600 beds that has COVID. So this is a marked improvement probably since the last time we spoke to a lot of people. This was the other change is that the vaccination programs got off the way. And of course, there were concerns. I know when we spoke in a previous webinar, there were concerns about the pace of this. So at the moment, 61% of all Irish people have been vaccinated at least once, and 31% have been fully vaccinated. In Ireland, it's different in different locations. In Ireland, they've been vaccinated by age. So they started the over 85s and 80s and so on. Now they're in the 35 to 40 group. So the take-up of vaccine in this country has been about 90% in those age groups, which is great, and higher than in probably any other country in Europe. So that's been very good, and it's been relatively well managed, I think, here. Now, of course, we do not know the future. We do not know what new variants. It's like your phone upgrades. There's a new variant every number of months. It's quicker than the new iPhones. It's the upgrades to them. But there are new variants. But we know that at the moment, vaccination is key, and we would encourage anyone that can get vaccinated as soon as possible to get so. I know there was a question forwarded prior to today about, I think, the Janssen vaccine, and at the moment, if you have had that, and that's a one-off vaccine, that is fine. That is vaccination in the same way as the Moderna, Pfizer, or AstraZeneca being two shots are the same as vaccination. In relation to Galway and students, so all students that were engaged in any clinical practice were vaccinated along with the doctors, nurses, and other staff. So in Galway, if you're engaged in clinical practice, you're viewed as a clinical, as a core worker, and you are vaccinated. That's not the same as the non-clinical students, although obviously some were for various reasons. Why do I mention this? Because students in this university engaged in their full clinical practice and went to, so no students missed out on seeing patients, engaged in face-to-face clinical work. I had students with me all the way through. And I think it's been a really good job. Obviously, there are some things that have to be changed. It's probably a lot busier for academics and for administrators and it was schedule everything. But students got a lot of excellent clinical input last year, despite in the midst of COVID and even the cyber attack. So and I've spoken to other universities, and that wasn't necessarily the case in Ireland and elsewhere. So I suppose I mention this because students are at the hub of what we want to do. We want to give students the best, I suppose, the best package and make them very good clinicians leaving here. So I suppose to sum up, COVID is being managed very well at the moment in Ireland. We have very, very few cases. There still are cases. We still are probably 200 to 300 people a day in Ireland are getting COVID. They're generally young people, but very, very few people now are getting sick. The hospitals are virtually empty of COVID. We can't tell the future, but the numbers have been going down very slowly and surely. And I think that's been linked mainly to a vaccination process that probably isn't as quick as some other places around the world, but it's still, but the uptake has been super. I think this augurs well for the future. And I think in Ireland we're good at doing what we're told in these regards. And I think that's worked very nicely. You know, we hope to continue going, and the students, and I know Peter will be able to speak more about the you know, the non-clinical years and first year. But we intend that students have an excellent experience here, and certainly a clinical experience, despite COVID having been present.
Thank you, Brian. That's been a great, very positive update on the COVID situation here in Ireland. So thank you for that. I'd now like to introduce Professor Becky Way, and she's our Vice President for International here at NUI Galway. And Becky's going to talk you through how NUI Galway is planning for hopefully a safe return to campus in the academic year 2021, and give you some updates around how we're planning nationally to help make that happen as well. Thank you, Becky.
Thank you very much, Deirdre. So first of all, I do want to really congratulate you on getting your place here at NUI Galway. It's not by any means an easy thing to do, so it's a fantastic achievement that you've got this far, and we really, really do look forward to welcoming you to NUI Galway for the next academic year. And I can imagine how fraught the journey has been for you in these really difficult times that we're in at the moment. And I appreciate that there's still a lot of uncertainty around just how that journey is going to, you know, how you're actually physically going to get here in the next few weeks. And I'll do what I can around that. So first of all, I just wanted to touch on the reopening of the campus. So what we hope this year is going to be like in terms of the experience that you have when you come to Galway. So the government has advised and is supporting us to try and open up the campus to as much face-to-face and in-person teaching as we can possibly do in all areas. So they're providing lots of guidance and lots of support for us in the process of planning for this. And huge amounts of work going on at the moment, trying to think about how we can make this work most effectively for the most number of students. And this does include sort of changes to the restrictions on how many students we could put in classrooms and some easing of that. So when you come on campus, our intention is that you will feel like a student on a university campus. The sports facilities should be open, the cafes will be open, there will be people moving around campus, and as and when you have questions and you need support, there will be people for you to go and speak to. We will still be asking you to follow the usual sort of protocols around COVID spread prevention, so making sure that you regularly wash or disinfect your hands, that you wear a mask where we ask you to, and in places where there are lots of people together, that you know, you cough appropriately and not into people's faces and over door handles, and the kind of things that we've all been living with for the last 15 or 16 months. I do have to add some caveats to this, because as we know from last year, we planned for an on-campus face-to-face experience, and then the situation around us changed. And our public health officers and the government advised us that we really had to scale that back massively and go over to online teaching as much as we could. For you as medical students, your school did a really fantastic job of still enabling you to do an awful lot of the practical work that you needed to do in your first year as a medical student, and did a huge amount of work in terms of trying to sort of make sure that the fact that you had to go online for your teaching didn't diminish the learning that you got through the year. So I really hope that's not the place that we go to, but we did it last year. And if we have to go there, we know a lot more about how to do it this year, and we'll be able to do it if we have to. So I think my take-home message is it's going to be we're really working towards making sure that you have a great face-to-face on-campus student type experience this year. But we can't control the situation around ourselves. And if and when, and hopefully not, we're advised to change that plan, that is what we will have to do, unfortunately. So the second piece of information is a little bit less clear, and I know it's the bit that you're really thinking about and asking questions, which is, what about getting here to Ireland? You know, how do I navigate the requirements and the restrictions around travel? Do I have to spend time in isolation when I arrive here? And all of those kind of questions. So my apologies, I don't have the absolute crystal answer to this at the moment. So this morning in my email, a draft policy arrived, looking at that and making plans around how this would all work. So we're still at the stage of working this out. And what I can tell you is keep an eye on the International Office question and answer pages, and also watch out for the email communications that we'll be sending out, both directly from the International Office and through Dee and the School of Medicine as well. But I think there are a few general points that it's that look like they're coming through. So one is, it's going to depend where in the world you're wanting to travel from, in terms of the kinds of requirements that are going to be placed on you. So, and it will also depend on your vaccination status. So if you're fully vaccinated with a vaccine that's registered, recognised in Ireland by the government, you are likely to have less requirements imposed on you in terms of how you travel into and through Ireland, and how much time you would have to spend self-isolating. We're going to definitely be using PCR tests to try and shorten the length of time that you might have to spend in isolation. And as with last year, we're looking at how we can support you as best we can, both in getting to Galway and spending a period of time in isolation. For some of you, the requirements are going to be different, either because you haven't been able to access a full vaccination programme, and or because you're coming from a country where there's a high level of COVID risk at the moment. So the requirements are going to be a bit more stringent for you. So I can't tell you exactly what that's going to be at the moment, but what we will be doing is, as soon as we have clarity on this and we have a clear, agreed national policy on how we do this, we'll be letting you have that information, and we'll also be letting you know what we can do to support you through that process, and how you need to contact us to make sure that you're getting the support that you need. So my apologies, I can't give you an absolute answer on that, but what I can give you is a promise that as soon as we know, you'll know on that. So I'm going to pause there because I'm sure there are questions, but let's go through the presentations and then we can try and pick up questions at the end. But once again, my biggest point is really delighted that you've got this far, really looking forward to seeing you in Galway, and really hoping that this year is going to be a great year for you.
Thank you, Becky. That's fantastic. I'm sure we will have plenty of questions on the two main topics you covered, but as you note, we will cover those towards the end of the presentation, and we'll give everybody a chance to ask what they hopefully we can give answers to. So now we're going to introduce Professor Peter Dockery. So at the outset, I noted that Peter is our Vice Head of the School of Medicine. He's an established professor in anatomy, and he's also the year head for the academic year 1. And in previous years has been year head for the foundation year program as well. So has a lot of knowledge and insight into the delivery of these programs. And over the next few slides, he's going to take you on, I think, probably a whistle-stop tour of what the foundation year and year 1 program will look like in terms of the content and some of the information around assessment and how that will look for the next academic year. So thank you, Peter.
And to move on slides, I'll tell you, yeah? Did right? Yeah. Yeah. Okay, welcome to Galway. We have been training medical students for quite some time. Some of the images you see here on the left-hand side are medical students in 1910. That's the last class that had a live graduation, not online. The facilities have changed. Galway in the 1930s is shown in the little picture on the bottom, and the new human biology building, where most of the preclinical teaching will take place. Next slide. Medical training in Galway is a modern systems-based curriculum with early patient contact, scientific foundations of medicine and clinical practice interwoven in a spiral curriculum. In phase 1 of the program, which is basically the early years, we look at normal structure and function and behavior. In phase 2, we begin to look at disturbances in that behavior. And phase 3 is very much about clinical practice. Next one. There are two streams running together. They're the 5 and 6 year course. Some students will enter a foundation year, and that's often students who maybe don't have the full complement and background in some of the basic sciences, and then those students will join the 5-year program. A key feature of the program in Galway is a modular vertical and horizontal integration. In other words, some of the early year scientific disciplines will re-emerge and reappear later in the curriculum. And clinical exposure, and I'll give you some examples of this, will come down into the early years. The horizontal integration is that the division between the disciplines, for example, anatomy, physiology, biochemistry, is somewhat lost. But we are retaining the safe elements of discipline-specific knowledge. So we go to the next one, please. Let's look at the foundation year, and this isn't simply a filling in year. Most of this is delivered by disciplines outside of medicine. So physics, chemistry, and biology are delivered by disciplines in the College of Science and Engineering. The one that I used to run and still teach on is the Introduction to Medicine module. Next one. In the Introduction to Medicine, there are 2 semesters. The first semester was called Early Patient Contact. We had to modify this to some degree with the advent of COVID, but basically it's an introduction to medicine at a very early stage in your professional development. The lecture topics include history-taking, communication skills, vital signs, introduction to clinical diagnosis, practical things like infection control, mental health, and multidisciplinary healthcare. But the thing that the students really like about this module, in particular the first semester, is that they have skills sessions. And I'll give you an idea of how much exposure you have in these practical sessions that include history-taking skills, but not just restricted to medical skills. There are many activities and skills such as empathy and professionalism that are actually delivered by the arts and humanities. It's a good time to build teams, but also to find friends in the system. Next one. In the second semester, we flip over a little bit to contemporary topics in medicine. And in this, which is the one that I primarily run from anatomy, we introduce you to human form, but we focus very much on the primary tissues of the body. We look at the organization of the coverings, we look at the connective tissues, the tissues that bind us together, the muscular tissue, and we look at nervous tissue. An important element of this early exposure is we begin to introduce medical imaging, and I'll come back to medical imaging shortly. Next one. But for all doctors, the human body is the focus for investigation and intervention on a daily basis. And it's necessary for core knowledge of the preclinical sciences to be assimilated by all doctors and healthcare professionals in order to practice and communicate safely. And something I'll come back to again. We produce safe doctors, hopefully kind ones. Next one. So although I've said that it's a modular curriculum, for example, you might be looking at the cardiovascular system. You'll have lecturers or teaching from physiology, from biochemistry, from anatomy. All of these disciplines are interwoven in medicine. I mean, chemistry is the stuff of life. Physiology is how it works, and how you can modulate and modify the physiology is what pharmacology, how drugs work. I'll say a few words on my own discipline. Next slide, yeah. One aspect of the course, we certainly look at macro to micro. We look at big things, small things. We also look at medical imaging. But an important aspect of the exposure you're going to get, and even during COVID times, we managed to deliver quite well on this, you will be carrying out human dissection. And the importance of anatomy in medicine is fundamentally placing function in a structural context. Where things happen in the body really matters. It'll determine whether or not you live or die if a particular tumor grows in a particular location, or it'll determine whether or not a burst blood vessel might be an important event. So we still try to retain what was good from the old system of teaching, the classic teaching of medicine. And so disciplines are still strong in this new modular curriculum that we've developed. Next one. Another attractive aspect to the curriculum from the student's perspective is that you have an opportunity to actually carry out certain special study modules. Sometimes these are very much focused in the healthcare, for example, in pre-hospital emergency care, basic surgical skills. But there are other outlets for your, because we have very much a holistic approach. You are students and we are trying to encourage all aspects of your development. So there are special study modules in medicine and the arts, and the medical school orchestra is what some students seem to enjoy. Next one. Just come back to medical imaging, and especially from an anatomical perspective, this is something that will reappear throughout your curriculum. We very much emphasize the importance of interpreting the types of images that you're going to see in clinic, whether it's a plain X-ray, whether it's an ultrasound, whether it's a fancy CT scan, or an image from an endoscope, which is shown on the screen. But it also links in very much to two major strengths of Galway. Whether you're interested in medical devices, whether you're interested in terms of nurturing your research interests, but there are two medical imaging core laboratories that have world standing. The first one is the Corrib Core Lab, which is very much about interventional in cardiology, that's recently been set up, and there's a slightly more established Centre for Neuroimaging. But students will be encouraged to look and explore possibilities of engaging with these centres in terms of developing a research profile as time goes on. Next one, please. So that's probably enough from me just now. There's a couple of questions that appeared before the session, and we'll go into them just now, Dee, because it's relevant. People have asked how much exposure in terms of what will the timetable look like. Becky's outlined the problems that we're facing in terms of proper planning, but I'll give you some examples. What we're looking at just now is that we're hoping to deliver all of the practical sessions almost up to the level of pre-COVID. So that will effectively look like between 4 to 8 hours of practical in anatomy or physiology, for example, in first year. In the preclinical year, you will have science practicals, and you'll also have the clinical skills element that I mentioned earlier. And the size of the venue and the number we're allowed to take into a venue will determine what type of delivery. What I've put up for you here is one example from the anatomy module in the COVID solution to our problem. But you can see what we have done, and the only modification for the coming year will be that the practical lab times will increase from what's there. So basically, what we delivered last year, we gave lectures live if possible. And what we're going to do is we're going to have all of the recorded material and the virtual sessions available to the students. But we'll also supplement this with weekly tutorial flipped classroom, depending on the size of the class. If you can take 50 students in, that'll work one way. If it's smaller than that, last year we had to work with smaller numbers. But we did manage to deliver. There's lots of metadata that we give you. We give you access to video resources. We give you access to various, sometimes specialized apps that the students interact with. There's also questions in terms of assessment. The first semester will be very much delivered in the form of continuous assessment, and that will be very much module specific. Sometimes there'll be MCQ type elements, multiple choice question type elements. Sometimes there'll be practical identifying features, a walkthrough like a spot test, for example, in anatomy. And you'll accrue marks in the different segments of the course as you progress. For example, this one happens to be looking at the shoulder region. And there's an assessment at the end of that students will pick up marks and will be added to your overall score. So I think I'll stop there and I'll take any questions in the Q&A. Okay.
Thank you, Peter. There is one or two other slides just about student societies and.
Oh, okay. So you can continue on. I'm sorry, you put that in the road, put it through me there. Another attractive aspect of the curriculum, we certainly encourage our students to get involved in undergraduate societies. Many of these are nothing to do with medicine at all, and it's certainly something that as medical students you should be joining and should participate in. But we also have a number of societies, some of them listed here, that are very much a healthcare element to it, ranging from the Pediatric Society all the way through to things like Best Buddies, where students team up with individuals in the community who maybe have intellectual disabilities. And sometimes the reward that you get for participating in these societies is enormous. Next one. Yeah. Other things that medical students very much like and get involved with is outreach activities. Everything from going to high schools, going to different communities, but also going to primary schools to actually encourage the next generation to actually engage in this process of learning. The student art is a thing that we have run for quite a number of years since I've moved to Galway, that we encourage, and this is some of the products of this year and in earlier years, in student art competition that we run. But so if you have a particular hobby or interest, follow it also. Don't just bury yourself in the work environment. The next one, please. Yeah. So take home message here, and these are two cohorts on the left-hand side of the screen. Our first years, the other ones were the Zero Med students. In Galway, we try to produce, and we do produce, safe doctors, and that's born about the curriculum that we deliver and the enthusiasm that the staff who are engaged in teaching. I mean, I'm the professor of anatomy, but I still teach Zero Meds. I still teach first years. It's not something that you're not going to meet senior faculty during your progression. But hopefully you retain something that you have just now, in that at the end of this sort of brutalizing process, we hope you still retain the kindness and be kind doctors. So two things that I've always been committed to: safe doctors and kind doctors. We'll stop there. Okay.
Thank you, Peter. That's been really good. Sorry, I threw you off with, I put your slides somewhere different. So I don't see any specific questions connected to the foundation year or year one program. So if you have any questions, please do pop them in the Q&A. I see a lot of questions connected to quarantine and travel and things like that, and we'll come to that in due course. But for now, we're just going to continue on with the presentation, and this hopefully will answer some of your questions. So some of you may have already seen on our NUIG website that we have released the academic year semester dates for September, and at the moment the teaching start date for our new incoming students is Monday the 27th of September, and the week before we're planning to run 3 orientation session. We would be hoping for an on-campus orientation, but as Becky has outlined, we're not that advanced in the planning yet due to the awaiting information from the Irish government on what we can and what we can't do. But we are working towards an on-campus experience. So for the perspective of planning, you can aim towards being in Galway, hopefully for Wednesday, the 22nd of September to start orientation, to begin teaching on Monday, the 27th of September. We haven't got the timetables prepared just yet. As Professor Dockery has outlined, we are busy working on these behind the scenes, and once we have them confirmed, we will be having them available on the NUIG website, and I will share all of that information with you. As Becky has promised, once we have it, you will have it. We're a lot further ahead of where we were last year, which is a positive situation to be in. And all going well, we'll be on campus on the 22nd of September. And I just wanted to point out as well, we have a number of administrators who work across the program structure. So while I will be your key point of contact for everything basically between now and the start of the academic year, I do have colleagues who work in the foundation year and year one of our program, and I have both of their email addresses up there. So we call our foundation year is called 0MB. So when you register, if you're on our 6-year program, that's the code you will see. And for our 5-year students, you will be looking for 1MB. So later on in the summer, if you have any questions or you just want to check in, feel free to contact me or any of my administrative colleagues on the email addresses outlined there. And this would be specifically for questions around timetables, maybe lab schedules later in the summer. We do create program handbooks. We use Blackboard, which is our virtual learning environment, and some students have issues with registration at the beginning. And also, most importantly, if you're actually going to be arriving a little later than planned and you're not going to be able to join us at the beginning of the academic year, please let us know as soon as you can, so we can inform our colleagues in the program, because we create groups in particular for labs and skill sessions, and students will be put into small groups where you will do small group teachings and tutorials. So if you're going to be late and you don't let us know, we will be expecting you to be there. So if there's any issues, and it's not a problem, just stay in touch with us and let us know if you're having problems getting to Ireland for the start of the academic year. Now, Becky also mentioned our international office. So whilst most of the people here on the call work in the School of Medicine and in our admissions teams are an educational agent, we have an international office which sits centrally in the university, who are working on some really fantastic stuff to help prepare you all for transit to Ireland in the next 14 to 16 weeks. And I just wanted to draw your attention to a few kind of key things, how the international office can support you over this period of time. So at the moment, we're working on a pre-arrival guide. So basically, this will be your how-to do everything. Hopefully, it'll be all-encompassing. But basically, everything to get you started on your student journey here at NUI Galway. And they're also available to address any questions around student study visas. However, our team of educational agents whom you will have applied through are also able to advise you on that. So, you know, if you're finding it difficult to get information or you're not sure where to start, please do reach out to us at international@nuigalway.ie and we'll do our best to answer your questions. For anybody still looking for accommodation, we've just come off a call with colleagues in the international office and they have advised that they still have a number of rooms available on the Corrib Village residence, which is based on campus here in the university. So if you would like to get a registration code for this accommodation, if you're still searching for a room, please email international@NUI and let them know that you're going to be studying undergraduate medicine and you heard that there was some availability in Corrib Village and they will sort you out. We also provide a lot of post-arrival support. So, you know, you will get a lot of information to get you here, but it doesn't stop there. So when you get to Galway, you will have a lot of probably questions around immigration, registration and orientation in particular in the first couple of weeks. And the international office and myself will be here to help you navigate that kind of, I won't say complex system, but everything is difficult when it's new. So again, feel free to reach out to us. You will have to register with immigration and I'll talk about that in a moment, 30 days after your arrival. And I'll talk you through how that happens in a moment. So through the international office and the School of Medicine, we will providing you over the next 14 to 16 weeks, we will be giving you weekly updates where we have something to update you on. And we will also be sending you a monthly e-zine, which will, you know, give you all of the updates for that month. So there's only 2 months left, you know, before you all make your journeys here. So, you know, they'll be jam-packed with information to help make that happen. And a really pretty cool new events that are happening this summer as well is we're arranging a number of virtual meetups, and there's going to be 5 scheduled for between now and the end of August, and the first one is taking place on July 2nd, and I'll share the information with you there on that event in a moment. But these are a really nice way for you to meet up virtually with obviously your classmates from medicine, but also from international students that will be studying undergraduate programs across the university in different disciplines, and also our postgraduate students. And you will also get a chance to talk to current students who through our student ambassador program. So they will be joining those virtual meetups to, you know, have a very informal Q&A chat, you know, and hopefully give you the student perspective on how to make your way to Galway and what to do when you get here. I would strongly recommend that you follow us on all our social media channels. In particular, we're very active on Instagram and also on Facebook. So make sure you look out for the International Office NUI Galway Facebook pages and Instagram posts, and you'll get lots of up-to-date information there as well, probably and very quick. So rather than waiting for your weekly email or your monthly e-zine, social media is a nice, quick and easy way to stay up to date with everything. So just to reiterate, there's the email address for the international office at NUI Galway, and the 3 links at the bottom of the page are kind of directly into the international office. There's a dedicated page for COVID-19, specifically for international students. And there's also the NUI Galway alerts page, which is another really good live source of information. So please bookmark those websites and check them regularly, and kind of maintain your social media presence over the next few weeks in case you miss out on anything. So the event I just wanted to draw your attention to is happening on Friday, the 2nd of July, and it's a virtual meetup, and it'll be the first of 5 over the next 14 to 16 weeks. So in order to get the information, you have to join the Facebook group for the International Students 2021. So if you're on Facebook or on Instagram, you can find the information on either those platforms. But the event will be run through Facebook Live. So you'll be able to, it's a private group just for incoming students. So it'll be a nice opportunity to meet up with your peers and your classmates and meet new friends from across the world in different colleges and schools and here in the university. So I mentioned at the beginning of the call, we have some colleagues here from admissions, and these ladies have been, you know, only for them that you wouldn't be here, because they generate all of your offer letters. So they've been doing fantastic work behind the scenes, and I just wanted to bring that to their attention, some of the services that they offer, you know, and the issuing the offers and managing the acceptances process. But they also kind of coordinate all of your, you know, documents that you submit to become a student at NUI Galway. And some of that would include your police clearance from your home country, evidence of your academic transcripts. So they process all of that information to ensure, you know, that we're meeting all of the requirements to enter our institution. And they're fantastic in terms of any questions you have around the general admissions process. You can contact Catherine, who's here on the call, Catherine Garrity, at the email mentioned here at the bottom on admissions related queries only. So any other queries around immigration or visas or fees or registration are all covered by different offices here at NUI Galway. So you'll see the fees office here is in the middle column, and they, as the name would suggest, they manage the fee, payment of tuition fee and deposits. So for medical students, full tuition has to be paid for the first year, and then you will have the opportunity to pay in installments, probably by each semester from your second year onwards. So any queries you have about fees, you can use the email address highlighted here, or you can also check out their website, which has lots of information on how to pay your fees, and any questions. There's a Q&A section as well for any questions you might have. And then finally, registration. So our registration dates were just announced just yesterday, and this is managed by a separate office again, all under the academic administration umbrella. So you won't be able to actually fully register until the 10th of September, and you can find more information at this link here. And you can contact registration directly at the email address here, or go onto their website where they also have an FAQ section. But you won't be able to fully register until the 10th of September, and also until your full tuition fee has been paid. So if you're having some issues registering, sometimes we find that although you've paid your full tuition, there might be a tiny balance due to the currency conversion. So it might be something as simple as that, and it could be like €1 or €2 or something like that. So if you're having any issues with registration, contact them directly, and they'll be able to sort that out for you, hopefully very quickly. So another important piece of information I wanted to share is about the health screening. So all medical students are required to undergo health screening, and you might have received this information through your educational agent already, but we will be sending an updated policy for the new academic year, and we're nearly ready for sign off on that. So we hope to issue it in the next week or so, and I will, please keep an eye out for that email from me. So there will be an online booking portal, and you will have to conduct your health screening through the student health unit here on campus at the university. And we will be screening for, we'll be looking at your vaccination and immunization history. So if, you know, please make sure that you get all of your evidence or certificates to illustrate that you have received the vaccinations outlined here for BCG, measles, mumps, rubella, hepatitis B, and varicella, more commonly known as chickenpox. And if you have any outstanding vaccines, these can be administered by the student health unit. But you will go through a series of 5 different consultations, and you will be, you know, receive a paperwork all the way through. So please bring your evidence of your vaccinations that you've received previously, so we can check them through the health unit. Unfortunately, all of the blood tests and blood work has to be completed here in Ireland, and any certificates or lab results from international labs won't be accepted by our student health unit. So please don't go to the effort of getting blood tests for Hep B, rubella, and varicella done internationally. They have to be done here in Ireland, and you know, if you do, it'll unfortunately be a waste of money. So please make sure that you wait and do it here in Galway, and everything will be recorded in our online booking portal. So that will be very comprehensive health screening, and this will allow you to engage in the early patient contact program and also all your clinical rotations. So we've had a couple of questions in the run up to the event around the vaccine program here in Ireland, and I'm not an expert in this area, but we did call the HSE just to get a better understanding as to, you know, if you're coming with one vaccine dose that you've received at home, will you be able to get a second dose of the vaccine here in Ireland? And the answer is yes. Now, you will have to call one of the two numbers here and speak to the HSE helpline in order to get a better understanding of what's needed and what you will need to provide and information. But the answer to the question is yes, but that's not the full picture. So please, if you want to know more information, please call one of the numbers outlined there and you'll be able to talk to a member of the HSE vaccine helpline who'll talk you through it. So Becky has also alluded to, you know, not being able to give exacting information on travel advice. And unfortunately, that's the same message I have in that I see a lot of questions popping up for specific countries. The best advice I can give you is to use the 3 links here on this page and use those to find out the information you need, because it changes regularly. And, you know, we have approximately 32 countries, students coming from about 32 different countries, so it'd be impossible for us to keep up to date with all of that information. But these are Irish-based websites, and they're the Department of Foreign Affairs and also the government website. So please check these websites very regular, and this is your primary source of information. So, you know, sometimes you do a quick Google search and it brings you off into an unknown website. Please just use these 3 sites as your primary source, and you will be kept up to date with everything you need to help with a safe transit to Ireland. So we're nearly there. I just wanted to outline a few kind of next steps, and we've covered some of them already, but I thought it'd be nice to summarize them so everyone is clear on what we need to do for the next number of weeks. So please carefully review the details in your offer letter and any kind of instructions that have been given there. In particular for conditional offer holders, if you're still awaiting your final results, please make sure to accept your offer. If you're going to come to us, pay your deposit, as this will confirm your place, and then stay in touch with your educational agent and submit your results once you have them. And all going well, follow the instructions on your offer letter, and hopefully you'll be able to pay your full tuition fee for the first year, and you'll be a registered student at NUIG Galway. And then you can happily start to plan your move. Please review your travel options very carefully as well. With COVID, some things, you know, are some kind of transport hubs are facing difficulties. I know traveling through the UAE in particular, that is deemed a high risk area. So if you're transiting from India or Malaysia, you know, please check those airlines and travel options carefully to ensure that you can have a safe transit without any issues on entry to Ireland. Also start to apply for your study visa. You might not, if you're a conditional offer holder, you may not be able to apply for it fully just yet, but please get all your paperwork together, because it can take a lot of time and a lot of back and forth with the officials that process your visa. So similar with your health screening, collect your certificates or your vaccination evidence, so that you're not surprised when you come to Ireland and you can't remember if you've had chickenpox or mumps or rubella. So please do start to plan it on those 2 areas in particular. Use the website links provided and regularly review the travel and public health guidelines for entry to Ireland and also departure from your home country. You'll be able to register from September 10th, and you will be able to schedule your immigration appointment hopefully towards the end of September, early October. And the International Office have organised a 2-week time slot for all NUI students to get their appointments here in Galway, which is fantastic. And we will be in touch with you all about that once you're here. So there's no need to worry about that part of the process just yet. And I think that is almost it. Yes. So thank you all for your time. I haven't had a chance to look at the Q&A box there while I was speaking, but we're happy to take any questions that you might have at this point if they haven't already been covered in the presentation. So I see there's an exact date.
You covered lots of things to do with the questions there. And the main thing that comes up, I think, is being vaccination and when to come, which I think you answered there. And
Okay.
I think the websites are very important, because I've been trying to answer one or two questions there with information from those websites, the Citizens Information Bureau. But basically, to my understanding, and Becky may know more, that if you're fully vaccinated, then you will have to quarantine at home, which could be in Galway for 5 days, and get another negative test, and then you don't have to then you don't have to quarantine anymore. But it's important to continue to check that information. At the moment, obviously, the rates of COVID in Ireland are very low, and obviously we're trying to keep it at that level. So if other countries are improving, it will be the same. So it's likely to be 5 days at home vaccination if you're vaccinated, or home quarantine if you're vaccinated. But keep an eye on the websites.
Yeah, absolutely. Thanks, Brian. Just so there's a few details around it that make it a little bit tricky. So when we talk about quarantine specifically, at the moment we're talking about what we call mandatory hotel quarantining, and that's you have to book into a hotel in Dublin, and you'll be there for probably up to 14 days. The other kind of term that we use at the moment is self-isolation, which is when you travel to the place that you're going to live in Ireland, or you're going to stay in Ireland, and you undertake your own self-isolation. So the mandatory hotel quarantine is the most kind of extreme and managed level of control when you come into the country. Now, if you come from a country that it doesn't matter which country you come from. If you are fully vaccinated with vaccines that are approved and recognised by the Irish government, and that bit's really important, because not all vaccines against COVID are recognised at the moment by the Irish government. And you come in with a negative PCR test, you can go to the place that you're going to stay in self-isolation. And at the moment, the rules say if you do another PCR test after 5 days, and that's clear, that's your isolation done. Exactly. If you don't have the vaccination and you come from a country which is listed on the designated countries list on the website that Dee gave you the link for, then you do have to go into mandatory hotel quarantine. But as I said in my presentation, these rules might change a little bit. And we're seeing countries coming on and going off the designated travel list quite quickly at the moment. So as Dee said, you have to keep looking at it to see what the situation is for the country that you're traveling from. And I'm describing what we're saying you have to do now, but that may change because we're trying to negotiate with the government to make it as possible for as many of our students to avoid mandatory hotel quarantine and come straight into the country and do the self-isolation if needed, or even avoid that if possible. So do keep an eye on our websites and do read the information we send, because this will change a little bit in the coming weeks as we agree some protocols with the government.
So I think the main thing is get vaccinated if you're not vaccinated. That makes your life so much easier. Self-isolation, and that could be with someone else who's coming with you for 5 days with another test. That's the best way of getting around any stress, I'd imagine. I have another meeting to go to, but I just want to say congratulations to everyone again, and we're delighted to have you. The Dean or the Head of the School of Medicine just wants to pass on their regards as well, and look forward to meeting you. And wants to mention to me and mention to you that she was delighted that you're coming here today. All right, and lovely to see you all again. Thank you.
Thank you, Brian. Thank you, Becky. Thank you, Peter. Thank you, everyone. I'm happy to stay on the line for another couple of minutes. If there's any questions that we haven't covered, I hope we've covered as much as we possibly could, and given you as much information as we can. Please feel free to stay in touch with me directly, or as we get closer to the start of the academic year, feel free to reach out to my academic colleagues and the administrators in the foundation year and the first year of the programme, and we'll happily assist with any questions. And, you know, once we have timetables, we will issue those straight away. I know at this point last year, we did issue some dates and timetables, and I think they changed probably about 4 times before the start of semester. So we've learned some very hard lessons from last year, and we're being more cautious this year. But that's purely to make sure we give you the information that you need and that it's valid, so that you can start to make your plans. But all in all, everything is looking very positive. We are very excited about the start of the academic year. We're very excited about our new international class, and we have a fairly big class this year. So we've hopefully between 90 to 100 students joining the program across our 5-year and our 6-year program from 32 different countries. So very diverse, very international, which will make it for a wonderful experience for you all when you get here. And hopefully, dependent on how COVID behaves and allows us to behave, you will have an on-campus experience when you will get to meet your new friends and get to hang out and be students and enjoy our wonderful city and our wonderful campus. And I personally look forward to meeting you all. I will be doing another webinar in August, probably around the 1st or 2nd week of August, and hopefully we'll have a lot more clarity and we'll be having a different conversation at that point. So if there's no further questions, we can sign off, and I'd like to thank all of my colleagues. Thank you, Becky. Thank you, Peter. And thank you to Selena again for organising, and thank you all for coming. And we hope you've enjoyed it and enjoyed meeting some of the team here in Galway. The school has a massive staff, so there's 250 or so staff in the Clinical Science Institution. You will meet many in the new academic year, so we look forward to that. Okay.
Thank you, Dee. Thank you, everyone.
Thank you, Becky. Thanks, everyone.